Sade McCollins, 2024, spring semester. Today's April 7th, 2024. Dr. Roberts is my instructor. I'll go ahead and scan the room. Okay, I'll start by inspecting my patient's skin. I am going to inspect the head face, the neck, the anterior, posterior chest, the abdomen, upper and lower extremities. Throughout the exam, I'll be checking for color, temperature, moisture, texture, edema, turgor, lesions, bruising, scarring, and nevi. Okay, with that, I'm gonna look at my patient's head. I'm examining for symmetry. The patient's head is almost cephalic. I'm looking at the size. I'll go ahead and inspect and palpate the patient's scalp. I'm checking for hair texture, hair color, and also hair color, hair texture, and hair distribution. Lesions, depressions, infestations, any tenderness, masses. Okay, now I'm going to palpate my patient's temporal arteries. Okay, I'll palpate my patient's lymph nodes. I'll start with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, and anterior cervical, posterior cervical, supraclavicular. Okay, then I will assess the TMJ. Bite down for me. I'm assessing for tenderness, any crepitus or subluxation. Next, I will go ahead and start my cranial nerve 5 assessment. I'm gonna have you to close your eyes and tell me where you feel this touch.
Forehead, cheek, chin, cheek.
Okay, that is cranial nerve 5. For sensory, for motor, I'll palpate the masseter muscle. Go ahead and clench down in your jaw. Okay, again, that is the motor sensory. So that is the trigeminal cranial nerve. Then I'll move on to cranial nerve 7. Go ahead and smile for me. Frown, raise your eyebrows, puff your cheeks, and puff your lips. I am assessing cranial nerve 7, which is facial. Okay, then I'll go ahead and move on to the ears. So I'm going to inspect my patient's ears. I'm looking at the shape, the symmetry of the ears, and now I'm going to palpate for the vagus and pinnae for any massive tenderness. I will inspect the auditory canal and the tympanic membrane. It is pearly gray. Auditory canal is clear. Now I will perform the whisper test. I'm going to say 3 letters.
ABC. ABC.
All right. The next will be the Weber test. All right. Let me know if you hear this in both ears or one.
Both.
Okay. Let me know when the sound stops.
It stopped. It stopped. It stopped. It stopped.
Okay. So I performed the Weber test, the Wren test, and the whisper test. The Wren test did show that air conduction was greater than bone conduction. All right. And that is cranial nerve 8. Acoustic. Okay, then we're gonna move on to the eyes. Okay, I'm looking at the eyes, looking at the brows, lashes, also palpable fissures. Also, I'm also looking at the red reflex, and I am looking at other internal eye structures. Okay. I'm also looking at the sclera and the conjunctiva, and I'm checking for color, discharge, and also lesions. So I'm going to perform the cranial nerve test. This is going to be the visual acuity, and I'm going to assess peripheral vision. Okay, and to do that, I'm going to stand here, and I need you to read the smallest print.
LT, FPA, LTFPH.
And
LTFPH.
the other eye.
LTFPH.
Okay. All right. I'm gonna stand here and assess your peripheral vision. So close one eye, and I will come in, and you let me know how many fingers you see.
1, 2, 3. 1, 2, 3.
Perfect. Okay. That is cranial nerve 2, which is okay. That's cranial nerve 2, and I'll assess cranial nerve 3. Cranial nerve 2 is optic. I'll go ahead and assess cranial nerve 3, which is oculomotor. Oculomotor, I'm going to assess the pupillary response to light. Okay, again, cranial nerve 2 assesses visual acuity and the peripheral vision, central vision, and 3, the pupillary response. I'm going to check accommodation and convergence, and then I will have the patient to cover one eye and follow other eye. With that, I'm checking conjugate gaze with the extraocular movements. And that is cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens. Okay, so I'm going to move on to the nose. The nose is straight, midline. I'll go ahead and assess nasal patency and sense of smell. Close one nostril, smell for me. Close one nostril, smell for me. All right, that is cranial nerve 1, olfactory, so sense of smell is intact. I'll go ahead and assess the lips. I'm assessing the mouth, which includes the lips, the gums, the teeth, the palate, the floor of the mouth, buccal mucosa, salivary glands, posterior pharynx, and the tonsils. So let's see, open up. All right. Okay, and with that, I'll also inspect for cranial nerve 9, 10, which is the uvula and the palate rising with phonation symmetrically, and also cranial nerve 12, which is the tongue is midline without fasciculations. Okay, I'll go ahead and palpate the neck. I'm feeling for the thyroid gland, the trachea, which are both midline. I am going to have you to swallow. Okay, and I'll shift it to the left. Swallow for me. All right, and I'll palpate the carotid artery. I'll listen for bruits with my bell. Okay, so I'll go ahead and have you to turn for me. I'm going to assess your posterior chest area. So the first thing I'm going to do is assess for any signs and symptoms of respiratory distress, which includes use of accessory muscles, tripod positioning, tachypnea, cyanosis, nasal flaring, and retractions. Okay. Also, I'll go ahead and inspect, observe for any deformities and symmetry, and also I'm going to palpate for chest expansion. Go ahead. Yes. Okay. So that is symmetric. I'm going to palpate for tactile firmities. Go ahead and say 99 for me.
99, 99, 99.
All right, so that was done symmetrically. The next thing I'll do is percuss the intercostal spaces. So go ahead and do that. Okay, then I'll take a listen with my stethoscope using the diaphragm. I'm going to take a breath from me. Okay, and I'll assess egophony. Go ahead and say E for me.
E, 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 E.
All right, and I'll go ahead and assess bronchophony. Say 99 for me.
99, 99, 99, 99, 99, 99, 99.
Okay, the next, thank you. The next test is whisper pectoriliquy. Go ahead and whisper 99. You can go ahead and turn around. And I will assess the interior portion of the long sounds. So the first thing I'm gonna do is check for any symmetry or deformities. Then I'll palpate for chest expansion. Go ahead. Okay, and I'll palpate symmetrically for tactile affirmatives. Say 99 for me.
99, 99, 99, 99.
Okay, I did both symmetrically. So you can go ahead and lay down for me. Oh, no, I'm sorry, sit up. Sit up, just sit up. I'm gonna listen to your lungs. All right, so I'm gonna listen to the aortic, which is right of the sternum, second intercostal, pulmonic, left of the sternum, second intercostal, Erb's point, left of the sternum, third intercostal space, the tricuspid, left of the sternum, fourth intercostal space, and mitral, fifth intercostal space, midclavicular. And I'll do the same with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'll inspect and palpate the PMI, and I will take a listen with my stethoscope for the apical pulse for a minute, noting the rate and rhythm. The rate is normal. I'm sorry, the rate is 60 and the rhythm is normal. All right, so the next thing I'm gonna do is have you to lay on your back. Okay, hold your head up 40, 30 to 45 degrees. I'm checking for JVD or jugular pulsation. You can lay back. Okay, then I'm going to check for any heaves or lifts, and then I'll palpate those 5 points of the heart. I am checking for any thrills, and then I'll take a listen again in those 5 areas of the heart with my diaphragm and my bell. Okay, then we're going to move on to the abdomen, which is symmetric, round, non-distended, so the symmetry is fine, and the contour looks normal. Okay, the first thing I'm going to do is auscultate with my bell, listening for a bruit in the aorta, the renal arteries, and the iliac arteries, and the femoral arteries. Okay, then I'll listen with my diaphragm in each of the quadrants of the abdomen for the vowel sounds, and then I'll go ahead and percuss in the quadrants. Sounds of tympany were heard, and dullness over the organs, and then I will palpate the abdomen, checking for masses and tenderness, and then I'll palpate for the liver and spleen. Take a deep breath and hold it. Okay, and both were not palpable. Okay, so go ahead and sit up for me. We're going to start the musculoskeletal. I am inspecting the upper extremities, which is the hands, the wrists, the elbows, and the shoulders. Okay, I am inspecting for any redness in those joints, tenderness, crepitus, symmetry, and nodules. Okay, so first I'm going to start off with the capillary refills, and I'm going to assess the radial pulses. Okay, and then I will start with the range of motions. We're going to flex, extend, hyperextend, abduct, adduct, and finger opposition or thumb opposition. Okay, all right. And also the next thing we're going to do is assess the wrist. So flex, extend, hyperextend, ulnar deviate, rotate. Okay, then we're going to move on to the elbow, flex, extend, hyperextend, and then the shoulders. So we are going to flex, extend, hyperextend. Okay, we will abduct, adduct. Okay, we will circumduction. We'll do the circumduction, and while you're doing that, we'll go ahead and test the strengths. Okay, so go ahead and squeeze my hands. Okay, and go ahead and push against, push against, push against, push against. Okay, and go ahead and abduct and push against, and push against. Okay, perfect. The next thing we are going to do is check for sensation of the upper extremities. Oh, and also, sorry, I'm going to check the shoulder shrug. So that is cranial nerve 11, which is assessing spinal accessories. Okay, so close your eyes and tell me where you feel the touch.
Right arm, left arm. Right foot, left foot.
Okay, now I'm going to test for vibration sensation. Tell me if you feel this.
Yes. 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 Yes.
Okay, and close your eyes. I'm going to put an item in your hand and you just tell me what it is.
A paper clip.
Only one hand.
I'm sorry. A paper clip.
Mm-hmm. All right. And in another hand, your right hand, tell me what this is.
A pen.
Correct. All right. And I'm going to write a number in your hand. You tell me what that number is.
3.
All right. So I tested for stereognosis, which was her identifying those objects in her hand. And I also tested for gravesthesia, which she was able to identify the number that I wrote in her hand. Okay, so the next thing we are going to do is start with our lower extremities. No, before we start our lower extremities, we're going to go ahead and get the reflexes. Okay. I'm going to change that. Patella. So I should be saying, I'm sorry. Brachioradices, bicep, triceps, patellars, Achilles, and Babinski. Okay. All right. So we'll start with the lower extremities. I'm going to have you to bring your feet out. I'm going to check for capillary refills in each toe, and also check for the dorsalis pedis pulse and the posterior tibial pulse. Okay, so the next thing we're going to do is assess range of motions in the feet. So I'm going to have you to flex, extend, hyperextend, and that's it of the toes. Okay, so for the ankles, I'm going to have you to flex, which is the dorsiflexion, and the extend, which is extending them like flexing out. That is the plantar flexion. So I'll go ahead and test for strength here. Press against it, the ankle, okay? And then try to flex. All right, so push up, push down, okay? Great. All right, and for the ankles, that's what we assess, the range of motions in the ankles. Next will be the knees. So go ahead and push against my hand. Push against my hand. Push against. Okay. And you can go ahead and stand up. So we're going to assess range of motion in the knee. So just a little, thank you. So we're going to extend, hyperextend, flex, extend, hyperextend. Okay. All right. And then we will move on to the hips. So we're going to flex, extend, hyperextend, flex, extend, hyperextend. Okay, so internal rotate, external rotate. Okay, internal rotate, external rotate. Okay, abduction, adduction, abduction, adduction. Okay, so have a seat one more time. Sorry, I did need to check your strength in your hips. So push against. Okay. All right, and you can go ahead and stand back up. Thank you. All right. The next thing we're going to do is check for the spine. Okay, so I'll have you to flex, leaning forward. I'm going to take a look at your spine, making sure it is aligned, no curvature, and no signs of scoliosis. The shoulders are symmetric. Okay, so you're flexing. Go ahead and extend, hyperextend. All right, so thank you. That was the lumbar spine assessment. I'll go ahead and do the cervical spine inspection. So also, before we do that, go ahead and rotate your spine by doing that. Okay, all right, so flex your neck up. There you go. Flex it forward. Yes. Yep. All right, extend. So hold it as normal and hyperextend. Lean back. Then we're going to laterally flex, so side to side, and then we're going to rotate. Okay. All right. And then we'll go ahead and start with the walking portion of this. So I have you to just walk normally across. Okay. And then we'll also do the tandem walk. So go ahead and walk heel to toe in a line, a straight line. Okay. Now we'll do the Runberg test. So I'm going to have you to come here. Close your eyes, hand side to side, and close your eyes. Okay. So you are coordinated and balanced. Now I will have you to hop on one foot and then change the other one. Perfect. Okay. So go ahead and sit down one more time. We need to complete the rapid movements for the cerebellar coordination test. So what I want to have you to do is do the flip flop. We're going to do the hand flop. So you're going to turn, do that. Okay. We're going to do the finger to finger test. So I want you to touch a finger, touch my finger, touch your nose. The other hand, touch my finger, touch your nose. Okay. And then also we're going to do the finger opposition. So to do that, you're going to put your thumb on your hand and go back and forth, and you're going to pick up the speed. Okay, so that was the rapid alternation movements to assess the cerebellar movements. That concludes our exam. Also, we need to do the okay, that concludes our exam.